Hello and welcome to another episode of the Christian Reeve podcast. Today's guest is a professional occupational therapist. She goes by the name Jessi Carling, all the way in the United States. Welcome to the show. How you doing?
Thank you, Christian. I'm doing great. I'm happy to be here. Thanks for having me.
Oh, the pleasure is always mine. This is, I can't believe it. I just have to take a moment to appreciate this. This is episode 280 of this
Nice.
podcast. Yeah,
Congratulations.
thank you. We're fast approaching 300 over the course of 4 years. And one thing I want to touch on just real quick before we get into things is like this idea of like being quite grateful and like having gratitude for the things that you're doing and achieving. And like, I guess reflecting on that every once in a while. Like I was talking to my partner about this today and she was just kind of like, have you not just sat and considered what you've done so far?
Yeah.
And why that's an achievement and so on. And I was just like, you know what? Maybe there is something to that. Maybe sometimes we get far too caught up in where we're headed or where we want to go that we
Mhm.
don't spend enough time to look at like what we've actually achieved.
Absolutely. When it all comes down to it, the present moment is all that we have. And so if we can take gratitude and place it on what's going on around us, then that leads to a very fulfilling life.
Speaking of fulfilling, because I knew a little bit about occupational therapy, I always do a little bit of research before I get
Yeah.
into to it, but I kind of like to like approach it fresh, just like my audience. So, you know, I'm also open and maybe I don't know about this, but when I looked into it, I was like, I can see how this can be a very rewarding career. But
Absolutely.
I'd like to kind of know, where did it start for you? How did you get into occupational therapy? Like, where does that journey begin?
Yeah, so you can have different undergraduate degrees. Mine was in psychology. And I went to a school that had an occupational therapy program. And so I was introduced to it more so they would have like promotional things to explain what the master's program was about. And I'd go to them and it looked like so much fun and so meaningful. And it aligned with everything that I was about for helping people. And looking back, I didn't realize that it was occupational therapy, say probably about 10 years prior. I had a friend's mom who had had an aneurysm. And I remember her talking about this therapy and how, after the aneurysm, she wasn't able to do her daily tasks. And, she was a housewife and a mom. And so that's a lot of her identity and purpose was wrapped up into the housekeeping type, motherly wife. Type chores. And so I remember when she was so excited because for the first time she was able to fold a washcloth. And that, again, taking that back to the gratitude, that's something we may take for granted. But for her, it was a big milestone that she was finally getting her hands working together and doing what she wanted them to do again. And so that was my first interaction with occupational therapy, but I really didn't know it was occupational therapy until after I went to college and learned more about it. But in hindsight, I was like, oh yeah, that was OT.
It's crazy how like you can take that stuff for granted.
Right.
Like I remember one time I was doing a live stream and I was just talking about just in general, like sometimes the struggles that you deal with every day, right? And
Mm,
one of the things I said was like how sometimes the best thing you can do is just get out of bed in the morning.
absolutely.
You know what I
Yeah.
mean? And
Yeah.
like,
And what a fortunate blessing to be able to get out of bed in the morning because I work with a lot of people who can't.
let's talk a little bit about like what it means to you. I mean, obviously, you identified that helping out people was something you wanted to do, and
Mm,
obviously, you later learned that there's a career for that. So,
yeah.
what does it mean to help other people? Like, what does that mean to you? Why
Well,
is that important?
to me, that's why we're here, is to love others and to help others because, we're only here, if we live the average life, mid 70s, right? So 70 years comes and goes. But if I can live a life where I can pour into other people and then there is often a ripple effect. They pour into other people and they pour into other people, and you just never know how big of an impact you could have on generations to come just by helping one person.
So, has there been examples in your career where you've done that and then you've seen that ripple effect, maybe helping out a group of people or something like that? Like, give me an example of that.
Absolutely. The first scenario that comes to mind, it was actually um, a family friend, and they had a medical condition where they didn't have insurance, and so they didn't have any therapy following. But the doctor had told them, don't push or pull anything with his hand. And his hand was like this, right? And so for the next 10 years, he didn't use this hand, right? And I say this hand, actually, it was both hands. Both of his hands were fisted because like if you have something neurological go on, a lot of times that increases the tone in your hands. Like you see people who've had strokes or aneurysms where their hands might be fisted, or cerebral palsy. And so he had this issue where his hands were like this. The doctor told him not to push or pull anything. He didn't have therapy, so he went home. And then 10 years later, he's still not pushing or pulling on anything because the doctor never clarified that that was just supposed to be for the first 8 or 10 weeks of recovery, until things like got healed. And so he was living his life without using his hands. His wife was doing everything for him. She had to quit her job, and she started doing like housekeeping stuff where he would, come with her and just like sit on the couch while she cleaned houses. Um, and like I said, it was actually a family, a friend, and it wasn't a patient of mine, but I was asked to help them. And so I, was able to teach them like, hey, it's okay, to push and pull now. And so I worked with his hand. I did different things, different stretches, different modalities to help his tone relax and decrease. And I'll never forget, well, I'll tell you the small win first. The small win was that once I got his hands open and taught his wife and him how to open his hands, he was then able to do so much more things as you would imagine. So when she was housekeeping, he was able to grab a hold of the vacuum and help her vacuum the house, whereas before he'd just sit on the couch and felt kind of helpless. Now he had more meaning. But the most touching thing to me was when she said, Jessi, I have not held my husband's hands in 10 years. And she was crying and she was like, thank you so much. I can't tell you, I didn't think I'd ever hold his hands again. And so, that's just one scenario of a million that, me or other occupational therapists could tell. But, it's it's a very rewarding job, and you see how the healing of one person affects their loved ones significantly too.
Thanks for sharing. Really appreciate that.
Yes.
We've kind of explored, or we've touched on a little bit about some of the examples of where a person might need an occupational therapist. And when I was doing my research, it did kind of become clear that a lot of it is to do with that day-to-day stuff, the little things that become something big. Obviously, like it might not seem like a big deal at first, like, oh, I can't use this hand, I'll use this hand, or you know what I mean? Like obviously that's a big deal, but like you see what I mean? It's like that kind of you as humans we're resourceful when we try to work around things, but sometimes it can get too much, or like if there's certain blockers in our way, it can drastically affect how we live our day-to-day lives. I guess the main thing that I'm really interested in with regards to this is at what point is it kind of decided that an occupational therapist needs to come into the picture? Do you know what I mean? Like
Yeah.
what are the kind of telltale signs of like, okay,
So,
this needs
occupational
help?
therapy serves a broad range of clients. It could be an infant all the way to 100 plus years old. And it also serves a broad range of diagnoses. It could be cerebral palsy, it could be a stroke, it could be a hip replacement, it could be a brain injury, but anything where somebody has had some sort of disability or injury or setback in some way to where they are no longer doing the things that they used to do, or they can't do the things that are, say, developmentally appropriate. So, kids with autism or developmental delays, if they're struggling with being able to hold a pencil, for instance. And so Typically, we get referrals from doctors, and then we'll do an evaluation. And from there, we can identify the individual's needs and make a plan of care for how to meet those needs so they can meet their personal goals to live their best life.
Thanks for giving us a sort of a breakdown there.
Mhm.
You mentioned obviously it helps children, it helps people with disabilities and the elderly, and obviously you can see the thread that binds them all there is like it could be, yeah, helping a child to adjust to something or, give them that little bit more help. I mean, I don't know if it's really quite the same thing, but when I was a kid, I remember I needed a remedial reader because I wasn't quite picking up reading
Mhm.
in fast enough, so I needed that assistance and,
Yeah.
we got there. But it's like every kid's different, and obviously as you get older, you deteriorate and the things that you used to be able to do you can't do, so you either got to find a way to work around that or we've got to kind of build you up to that point again where you can do that. And of course, for people with disabilities, I mean, generally speaking, that's going to be a lifelong thing, isn't it? So you're going to have to essentially like relearn how to live life, or perhaps like if it's something that you're born with, then that's something that you learn, like, okay, this is what life is going to be like for me moving forward. And that therapist is going to be that person guiding you every step of the way, I would imagine. Would that be right to say?
Sure, yeah, absolutely. We are there to be of service to our client in whatever way that looks like. And like you said, it can be a very diverse and broad range of things.
I'd also like to touch on how exactly, or maybe a better way of putting this would be when someone is dealing with severe trauma, severe injuries, how does that role change then? Like what would your role be in an instance like that? How is it different to
So
just
you mentioned trauma. Do you want to talk about like the psychological aspect? Because you also mentioned injury. So are you talking physical injury or both lumped in together?
yeah, it could be either because obviously you would approach those differently, wouldn't you? But
Sure, yeah.
yeah.
So let's just bind them together and say we could work with veterans who have experienced physical trauma in war, and obviously with that comes, often PTSD, and so we would address both of those aspects. And so, say they had an amputation on their leg, so I could help teach them how to, or so let's say they lost both their legs, okay? Let's say they lost both their legs. I can teach them, okay, how am I going to get out of bed into a wheelchair and from a wheelchair to a toilet, right? Because you think you don't have legs, how do you make that happen? And so we have devices like a sliding board where we can help increase their upper extremity, their arm strength, and help them scoot along that board to get to where they need to be. And also, we could set goals to address their PTSD too. So if they are, struggling with the anxiety, we could set a goal for them to be able to identify and demonstrate good understanding of techniques to reduce their anxiety when faced with a trigger. And so that is the quick answer, I guess, for how we could address both of those. But again, each individual and each, everybody is going to be unique. And so there's really never like a blanket way to do things. It just depends on what that individual needs.
Walk us through like a typical session with an occupational therapist. Like someone walks into your office tomorrow, how are you approaching that session?
For the first time or for a repeat visit?
Oh, fair play, fair play. Yeah, let's start with the first session and we'll go from
Okay.
there.
So the first session is going to be an evaluation. And so again, it depends on the client. And it's going to look different if it's an infant versus if it's a child in the school system versus if it is an adult that just had surgery. Just to make it simple and not so confusing, let's just say we're working with an adult that just had hip surgery. And so I would see how they're doing with all of their daily activities. So after hip surgery, it can become very difficult to get dressed, to bathe yourself, to get on and off the shower chair. And so I would assess all those things. How are they doing with their daily tasks? And within that, I would break it down further. Like, okay, are they even cognitive enough to do these things? So I can assess their cognition. Are they strong? Is their arm strong enough to do what they need to do? I'll assess their strength. How is their balance? What is their pain level? What is their, do they have a fear of falling? So there's just a broad range of things that I would assess. And then from there, I would ask them what they want to work on the most, what is most pressing for them. And together we collaborate to set those goals and the plan of care. And for a child, just for instance, to say it was a child with autism and he had sensory issues, I might be looking more so at, how is his interactions with his environment? Is he sensitive to sounds? Is he seeking movement and spinning around all the time? And how is that influencing his day to day with his classmates or at home or even just his own safety? And so I would, with the younger child, also do interviews with the parent to get their feedback as well. And, and just again, collaboration is key for seeing what their personal goals are.
Do you ever get, I suppose you would sometimes get like conflicts of interest, maybe, like where, you've outlined a plan, say for a child or and someone who's elderly, and you've got a caregiver or caretaker or whatever who might disagree with the plan you've laid out. Like, how do you then approach that?
Yeah, so ultimately it comes down to, is the person who I'm serving, are they are they their own, let's say, POA, do they have a POA? So if I'm working with somebody with dementia, it might look different. Say, okay, her daughter really, I've got a lady, let's pretend, with dementia, and say her daughter really wants me to help her mom to be able to get out of bed and increase her time out of bed because to reduce her risk for bed sores because she has a history of bed sores for say. So there is kind of what I'm hearing you say when you ask, like, is there ever any like resistance? So there may be resistance with the person with dementia. She may not want to necessarily, do everything that we know can help prevent the bed sores. But that's really when you use what we call therapeutic use of self. And so I'm going to approach that person very differently than I am with somebody who is, let's say my same age and has, good cognition. So with somebody with dementia, you have to get into their world. You have to figure out what motivates them. And, and they always have the right to refuse, And so if they tell me no, I have to accept that. But I can also try little things that I have seen work before to motivate them. Maybe it's not that I say, hey, let's get up and exercise, and they're like, I hate exercise and I don't want to do that. Maybe it's more that I say, like, hey, I heard they're playing some music down the hall. Let's go take a walk and listen to it. So you really have to dive into what motivates that person to give them the best care.
What would you say has been the most challenging experience in your career so far?
Oh, that is a good question. The most challenging experience, I'm gonna say dealing with insurance, to be honest. And, it's challenging because so often I will see how much a patient needs therapy and could benefit from therapy. And unfortunately, sometimes insurance companies will say, we're not going to pay for their therapy anymore and we're going to send them home. So, that's a really tough situation where somebody needs therapy, and if they don't have the money to pay for therapy, and say their insurance company is like, well, we're sending them home. And, if they go home, they are going to have a fall. They are going to end up back in the hospital. They are going to decline, just based upon your clinical judgment. And so that's definitely the biggest hurdle as a therapist. So, and
That's
I will
sure,
say,
for sure.
that I was fortunate enough to work with an amazing pro bono therapy clinic in Texas a couple of years ago that provided free therapy for people who needed therapy, but for whatever reason wasn't able to get it. Maybe they didn't have insurance, and so even when there's hurdles, it's also our job to figure out how to overcome those hurdles. And so that was a pretty cool situation where I saw people who couldn't get therapy, and to be a part of that was pretty amazing.
What would you say has been the most rewarding experience in your career so far?
Oh, the most rewarding experience. It's all very rewarding.
I can
Um,
tell, yeah. It seems like a quite a I don't know what the right words would be, but like the nature of the job is to help people. So there is
yeah,
that. But then
yeah.
also, every single day you're trying to cultivate plans that are gonna essentially
hmm
change people's lives if you really think about it.
All right, yeah. So it's really hard to pick just one, but I'll speak to an experience that really stands out to me. Is There was a young man, and he was totally independent, just like you and I. He had again neurological condition that one day he was doing all the things just totally independent by driving, mowing his lawn. He played the piano and all this stuff. And then, bam, just like that, the next day he's in bed. He cannot roll side to side. He cannot dress himself. He cannot feed himself. He cannot brush his own teeth. And so I remember him on day one. And then I remember the day that he discharged. And again, it can be an emotional thing, but he's crying and he's saying, you know, thank you for helping me get my life back. And he went from totally dependent to totally independent. And not only with his daily tasks, but again, those leisure things, being able to play the piano, which he thought he would never, he just wasn't sure if he'd ever be able to do that again. And I believe his exact words were, you didn't just help me get my life back, but you helped me get my soul back. And that just like pierced my heart. And just to see this this man just be so thankful for the therapy he received, and to watch anytime there's a huge night and day contrast. That's just so rewarding to see. Totally dependent to totally independent is just like, yeah, that's what it's all about.
Speaking of independent and non-independent, what role do family members and caregivers play in the overall occupational therapy process?
Yeah, so we train caregivers. That's a big part of occupational therapy. We want to educate caregivers. If it's an infant we're working with, we can train the mom on, or the dad on, things to do at home with the infant to help further improve their posture or their, joint alignment or their strength or whatever we're trying to address. And same thing with the older adults too. Caregiver training, just like I was talking about, teaching the lady, how to gently get her husband's hand open when that tone was high, how to decrease that tone. So there's I feel like we educate caregivers anytime we see them and interact with them, because it's that you're going to get better carryover if you're not just involving the patient, but also their support system. So that's a big aspect of it.
What would you say are the biggest misconceptions surrounding occupational therapy?
The biggest misconception is that we help people get a job. So they hear the word occupation,
Oh,
and so
right, yeah.
and so
I
we'll
didn't
walk
think of
in and
that.
I'll be like, "I'm your occupational therapist," and they're like, "I don't need an occupational therapist. I've been retired for 10 years." you know. And we're like, "No, no, occupation or anything that you do, not just your occupation, 9 to 5." So yeah, or some people will think like we're just like PT, like, oh, you're a physical therapist. No, there's some similarities, but there's a lot of differences too.
Yeah, I was going to say, because one of the first things I thought of when I was reading into this was rehabilitation. Obviously, like someone goes through, let's say, like a life-threatening, illness or something, and they lose their mobility and whatever, and like there might be some crossover maybe, but like you wouldn't be involved in like that the physical side of it. You obviously you'd probably work maybe in conjunction with like physiotherapists and stuff, but like you wouldn't be responsible for that. Is that right?
We're two different types of therapy.
Yeah.
Usually, if somebody is, in the hospital and getting physical therapy, chances are they probably would benefit from occupational therapy too.
Mm.
And so there is overlap, but just as kind of general statement is physical therapy works more on mobility.
Yep.
Occupational therapy works more on function. Typically, physical therapy usually handles more of the lower body. Occupational therapy handles more of the upper body, but again, there's some crossover too. If I'm working with somebody who's not getting physical therapy, but I'm their occupational therapist, then I may, work more on the mobility in the lower body and vice versa. So there's crossover, but it's kind of like physical therapy teaches you to walk and occupational therapy teaches you to like dance, you know? So there's similarities but differences that are significant.
How is the field of occupational therapy developing? Let's say from like a technological standpoint.
Yeah, so COVID was a big changing point for therapists, I believe, because, a lot of people were told to isolate and do this and do that. So that was a catalyst for more and more people to do online therapy. And since then, we still do face-to-face therapy, but that to me is the newest development in the past, 4 years or so is that we're seeing more and more online therapy. So that's interesting to me and something I personally would continue to like to dive into.
What do you think the future of occupational therapy looks like?
The future of occupational therapy, again, I see more online and I see, as the baby boomers get older too, I see us needing to serve more of them as well. So that older, the baby boomer generation is getting older and older. And so I see a lot more need for working with that geriatric population in the near future.
What would you consider to be some of the more commonly used techniques and forms of interactions in occupational therapy?
Oh yeah, that's a very I have a very broad there's a very broad answer for that. There's a million different techniques. So common techniques. Let's just say if I'm working with somebody that's had a stroke and their hand is not working like it used to, you really want to just give that hand a lot of attention and a lot of like deep pressure, maybe some joint compressions. Just, maybe you can brush it and rub on it and, have the patient practice, using it as much as they can and increasing it. You could also, we have electrical stimulation that we could actually put pads on somebody's hand, say they can't move it, and those pads have electrical current coming through and it contracts their muscles when they can't. So it makes their hand move. And so that's a technique. There's so many techniques. It's hard to just tell you about a couple of them, but adaptive equipment, we use a lot of adaptive equipment. So like sock aid, shoehorn, dressing stick, wheelchair, that would be an approach. And teaching people compensatory techniques too. So if somebody has a vision field cut and say they've had something happen to where they can't really see what's going on over here, you teach them, to get in the habit more of turning so that this eye can see over there for where that, blacked out spot is. So those are a few examples: adaptive equipment, compensatory techniques, and rehabilitative.
How can people learn to incorporate occupational therapy principles into their daily lives to kind of have better health and well-being in general?
Yeah, so, prevention is key. And so if we can maximize our health before something happens and reduce, somebody's fall risk before they fall and before they get an injury, that's a great takeaway. There's things that you can do around the house to help make it a safer environment to prevent those things from happening. Obviously, diet and exercise are a huge component in prevention, and just knowing that if you're struggling with something, there's options and techniques and methods that can help you overcome that. If you feel like you're stuck, you may not be. See an occupational therapist, and we may be able to help you out.
What has occupational therapy taught you about life?
It has taught me how valuable life is and to not take the little things for granted, like we spoke about at the beginning of your episode, and that it's life is just all about, helping our brothers and sisters and passing on, the goodness that we've received, passing on that to others.
What advice do you think you could give to aspiring occupational therapists?
I would say get in as many volunteer hours or shadowing hours as you can in various settings to really understand, if it's for you or not for you and the direction that you might want to go in.
So I want to take a quick second to just say thank you so much, just for being on the show. Like, feels I feel very much like I've just been firing questions at you, and you just been like knocking it out of the park, and I'm like, damn, like I feel bad, but like
Oh, you're good. You're doing great. No, I think this is going great.
I hope so. It's just
I mean,
I don't
that's what
know.
a podcast is, right? You ask questions and I answer them.
Yeah, yeah. It's just I don't know. It's interesting like how every show actually goes. Like the dynamic is different every single time. Because obviously shows like this, they feel a little bit more professional. That's not to say other episodes don't, because I always approach it with the same mindset. But sometimes it's a bit more relaxed, sometimes it's a bit more formal.
Mhm.
But I always like to treat it, you know, in the same way with just like that level of importance. And particularly because, when you see, because something I changed on the podcast recently is I've started trying to lean more into having topics. If I have a particular guest who has, like a particular profession or a passion in life, something, a particular story, I like to lean into that because, I've never spoken about occupational therapy on the show before. And,
Right.
maybe it goes
I
back
think
to
you're
my
asking excellent questions, and we're heading in the right direction.
I think it's like ever since I went to uni years ago, it changed the way that I approach like research. Because I
Mhm.
used to read like endless journal articles and just sit and kind of like delve into a topic and get my own understanding of it before I'd then begin to write about it, right? And
Right.
I've said this on the show before, but to anyone who's ever done a podcast or going to you're going to do your own show, it's like you really do have to do your research and learn and understand what you need to ask. Yeah, you kind of have to like already know about it in order to ask those
Yeah.
questions.
Yeah. Well, I
I
can
don't
tell
know.
you've done your research.
That's a good start. I appreciate that. Thank you. So obviously you're also a content creator, and one really really cool thing that we've seen in sort of the last 5 to 10 years is a lot of people in these serious scientific professions, psychological professions, and beyond that are taking the things that they've learned that they spent years tirelessly working on and bringing that to the public, like giving people a bit more of a window into like everything that they do. And also, I think it has multiple purposes because on one hand it can inspire people to maybe follow that career path. For others, it can make people understand, like, oh, well, why might I need an occupational therapist? Well, here's why. Um, so it's useful, but I'd like to kind of explore a little bit about why you decided to start getting into, content creation and yeah, let's go there.
Yeah, so I've been doing content creation for a few years now, and it started off just wanting to encourage people and putting encouraging words out there and just a little bit, here and there. And so it was really just me following my hobbies. And so I like to encourage people. I also like photography. So a lot of times I would put the quotes with my photography for encouragement. And I enjoy the videography too. And so for the first few years, I was just kind of doing content creation on things that were important to me, faith and encouragement and health and traveling and food and, just anything I was interested in. I was just kind of just putting it out there for people. And again, I think that goes back to also, being having more of like a teacher heart. I've always, my mom was a teacher, and I think there's certain people that gravitate towards the desire just to teach others and to share knowledge with others. And so I had that innately in me. And then one day I was just like, you know what? I've been doing all this content creation with all these other interests. But you know what? The thing I know most more than anything is about occupational therapy. So I was like, I should really start doing a focus on that as well. So I started a new page to just solely focus on occupational therapy, but I'm also continuing to post on my regular page to the other things that I mentioned as well. But it's just something that for me goes back to again that ripple effect. If I can have a positive influence on another's life and, then my life has been worthwhile.
What have been the most rewarding experiences in that sphere? Because obviously you're helping lots of other types of people, you're reaching more people.
Yeah, so it's rewarding when people tell me how much my content means to them. If I'll have feedback saying, wow, I really needed to hear this. You don't know how much this means to me. I was struggling with this, that, or the other, and then I saw your content, your post, your video, and it really just uplifted my spirits or helped me shift my mindset into a better, healthier direction. And so it's really just that feedback of knowing that I had a positive effect on somebody's life.
What's the best advice you've ever received?
Ever on anything?
It can be anything you want.
Love God and love others.
There you go. So religion's important to you. We've touched on that a little bit, but like, how does that shape your life? Well, how does it shape your work actually?
Oh, well, I mean, it's the foundation for my motivation for what I do, is that's the most important thing to me. And so that is, a daily motivation for me to continue doing what I do and giving it my best.
One thing I find interesting, I assume it's the same with occupational therapy, is so are you able to help like people friends, family, stuff like that, or would that be like a sort of a conflict of interest?
No, I do help family and friends, and it's usually just me helping them. I don't charge them anything. I don't
Right,
go through
right, right.
insurance. It'll just be like, just like the family friend I was telling you about that had the two hands that were clenched. He didn't have insurance. He'd been, living this life of barely, being able to do anything for so many years. And so, yeah, I'll help family and friends. Um, so definitely it's just part of what I do.
What's the biggest life lesson you've learned so far?
The biggest life lesson I've learned so far is to just let it be. You can't control the outcomes 100% of the time. You can only control your own actions and thoughts and behaviors and emotions, and being able to just surrender everything else has been a key life lesson for me.
It's tough. How do you learn to do that? Well, how did you learn to do that?
It's a daily practice. Again, it goes back to my faith and knowing that, you know, I can do all things through Christ who strengthens me, and knowing that I do my best in life, but He fills in the gaps. And, there's one quote by, I think it's Elizabeth Gilbert, and she said, you thought um, you had control, but you really just had anxiety, and it's like, it's funny because we do have control over things, but there's so many things that we might worry about that are outside of our control. And you know what? Worrying doesn't get you anywhere. We were actually talking about this in church this morning. The Bible says, do not worry, I think like 365 times. And, God talks about how He takes care of the birds and the, grass, and how much more is He going to take care of you. So again, it just goes back to I have a strong faith in Jesus and God. And am I perfect? No, sometimes it's a daily laying down of that surrender. And sometimes I might pick it back up and worry about something, and nope, I gotta lay it back down, and kind of, here's another illustration that I was thinking about the other day. It's almost like if you're holding a hot coal, and so say that's your worry. You're holding a hot coal and you're like, oh, it's hot, well, lay it down, just drop it. But
Yeah.
so often we hold on to those coals and just let it burn us when worrying isn't getting us anywhere. Um, and so that's just an illustration. Some people, maybe it'll help. Some people might be like, what is she talking about? But I trust that
No,
it'll find the right ears.
no, I get what you mean. It's like I saw like a meme the other day where it was like, well, it's not even really a meme. It was like two little creatures trying to push a boulder up a hill, and
Yeah.
the boulder was supposed to represent like worry or something, and the one in the back just goes like, "Wouldn't it be easier if we just let this go?"
Right. Exactly. Yeah.
I mean,
It's
I will say it is easier said than done, though. I mean,
for
like
sure.
when I look at my own concern and worry,
Yeah.
I know that I'm practical enough as a person that I'll find a way, I'll figure it out. That's me. But I mean, it's a feeling. It's just there, isn't it? Like, do you know what I mean? It's like when you're sad, you're sad. When you're angry, you're angry,
Yeah.
and you find your way to work through that.
Yeah.
But
We all experience an array of emotions, of different emotions, and that's part of being human.
there it is. Final question for you. Do you have any upcoming projects or final thoughts that you'd like to share with our listeners?
Oh, um, no, I don't have any projects that I can speak about publicly yet. I do
Ooh,
have some projects that are in the works, and I'll share more on my social media later. But I appreciate you asking for that opportunity.
no worries. It's been an absolute pleasure having you on the show.
It's been a pleasure being on your show. Thank you so much, Christian.
Yeah, thanks for appearing and giving us a bit of an insight into occupational therapy. I know that our listeners will be thankful. And yeah, just massive thank you.
Well, thank you so much. I appreciate you having me. And if you have any follow-up questions, feel free to reach out anytime.
There you go. And to the listeners of the Christian Reeve podcast, if you do have any more questions, let us know and we will sort that out. As always, make sure if you're listening or watching on YouTube to like, share, and subscribe. It helps us out. I know it's annoying hearing it for 280 times, but I'm not going to stop until you subscribe and you support the show because it does help. I am seeing the numbers go up, which is exciting. I don't know. I don't know if that's the beginning of something. I don't like to get ahead of myself, but I don't know. We've been doing this for some time now, and it's amazing all the different types of people from all the different walks of life that we're getting on the show. Um, I don't know. I spoke about gratitude at the beginning of this. I'm
Mhm.
grateful that I get the opportunity to do this because for too long I focused on numbers and views and all the other stuff that people worry about online. And really, the thing that matters most is the conversations
Yeah.
and laying it down. I don't know what the future holds for this show. I know I'm aiming to get to 10 years. I will do that. It's 4 years in, so there's 6 more years to go.
Yeah.
But when all is said and done, there will be a wealth of information and life lessons throughout those years.
I
And
love it.
that
Well, you're producing some great content, and you just keep doing that, and everything else will fall into place.
let's hope. Let's hope. Yeah. So if you're listening on YouTube, make sure to leave us like I say, like, share, subscribe, leave us a comment there as well. Let us know who you want to see on the show next, what you want to hear on the show next. If you're listening on Spotify, Apple Podcasts, wherever you listen to the show, leave us a review, leave us a rating. It will really, really help out the show. If you want to support me and everything that I'm doing and get yourself some extra content, go to patreon.com/Christian Reeve. Thank you so much for watching and listening. And as always, be safe, be well, and I'll see you in the next one.